Hi, welcome to another episode of Conversations with Eminent Women. On this platform, we speak to women that are doing phenomenal things in their different spheres. My name is Tsegoha Moagi, and today we've got the pleasure to be speaking to Professor Salome Maswime, who's the head of School of Clinical Medicine at Wits University, and she joins us today. Hi, Prof. Thank you for your time.
Hi, thank you so much.
So let's speak about who Professor Salome Maswime is outside of the titles.
Cool. So I'm from Limpopo, originally from a place called Botlokwa. Grew up mostly in Limpopo, in Venda, actually, Polokwane. And yeah, just an ordinary South African from Limpopo, medical doctor, specialized in obstetrics and gynecology. I'm a mother. I've got 2 sons. I'm a wife. Yeah.
Why medicine?
So it was interesting. I mean, high school, I guess I got to a point where I needed to decide what I wanted to become. And towards the end of high school, I felt deeply that I wanted to become a doctor because I felt I could make a difference. And I think in those days, it really felt like a very noble career. And yeah, I think I was inspired and felt that it was a career that I should pursue because I really wanted to help others and to make a difference.
Helping others and making difference is a big thing. But then specializing in obstetrics and gynecology, that is something completely different. What drew your attention to that particular field?
So it was a journey. So obviously you go through medical school, become a doctor. I did my internship and then did my community service. And it was actually, I didn't choose obstetrics and gynae because I loved the labor ward. I chose it because initially I experienced some deaths, pregnant women die and you're the doctor that's looking after them. And then later on, whilst working in the labor ward, it was the babies as well. So babies who are stillborn. And I guess those are the things that kept me up at night. And I felt frustrated and felt like if I knew more, if I understood more, maybe we could have been able to save those lives. So it was a decision really based on, I guess, compassion and feeling that if I'm more empowered and more equipped, I could contribute to saving more women's lives.
Let's speak a little bit about some moments that may have defined your career. That very situation of seeing women dying. I know that during your internship, if I'm not mistaken, you actually witnessed this. How do you think those kind of moments have defined your career path and your journey in medicine?
Yeah, they definitely have, and it's, I guess we're all very different because one of the things with medicine, you deal with life, you deal with death, so you deal with birth, the beginning of a life, you deal with lives being lost, you work across different disciplines. For example, if you're in pediatrics, you might find for some people, the compassion of saving children and babies and all of that, that's what comes naturally to them. For others, it's infectious diseases, and we're all different. But for me, the idea of a mother losing their life during childbirth or related to pregnancy or immediately after the pregnancy, that was my area of compassion. And that was the area where I felt I wanted to make a difference because I really just felt that pregnancy isn't a disease, and a pregnancy that goes well, you should come out with a baby that's alive and a mother that's alive.
And healthy, both of
And
them.
yes,
Of
yes,
course.
yeah.
You've achieved some really great things in your career. What do you think has kept you grounded?
I think it's the passion for what I do and the conviction. I think it's a combination of those two because I know people chase titles and people chase money and all of these things, but in my career, I think I've really tried to pursue my purpose and never really feel satisfied, that, when I realize that, okay, I've done a lot, but, women are still dying, babies are still, being stillborn in places where they shouldn't be. And I guess when you live a life with a clear purpose and a clear agenda, I guess the awards, the titles, and all of that will come with it, but it's not what keeps me going. It's really the satisfaction of fulfilling, I guess, what I feel I was born to do.
What do you think, Prof, are the reasons for that? You know, keep speaking about women dying during pregnancy or even after pregnancy, babies still being born, still being stillborn in this day and age. What is still contributing to that? Is it lack of education? What is it?
Yeah. So, I mean, we can talk about the clinical reasons and we, I can give you a whole lecture on what are the causes of death related to pregnancy, etc. But inequality is the biggest. It's really the biggest to an extent where you are, which hospital you're in, which country you're in, which city you're in, at the time that you need medical care is more likely to determine what your outcome is going to be. So and I'm talking about people that are women that are who have complications related to childbirth in villages where the nearest hospital, is far. It's 100 kilometers away. There are no transport or reliable transport systems, and the financial barriers that they have to reach hospitals, etc. And so for my career and my journey, I think it's when I realized that there were disparities in healthcare based on socioeconomic factors, based on political factors, that I felt that we really needed to look at strengthening health systems and not simply looking at training better doctors, because there's only so much you can do. If a woman needs to go into ICU and there is no ICU, for in the next 200 to 500 kilometers, what's going to happen to that woman? So you can train excellent doctors, but if they don't have the resources and the facilities, there's very little they can do to save lives.
Absolutely. Let's then speak a little bit about your journey. Just walk us through your journey, actually, from growing up in Limpopo, deciding that you want to do medicine, to you sitting in this big chair now here at Wits University. Talk to us about this journey. How did it all begin and the process to get to where you are? I mean, to be a professor as well.
So I'll start maybe a bit with my own childhood, because just to show you where my inspiration came from. And so, I mean, I was born when my father was pursuing his master's degree, and shortly after he got a scholarship to do his PhD overseas. And I was the youngest of 5 children, and he took us along, and we were part of that journey of him pursuing his academic studies. But shortly after, and my father became a theology professor. I mean, he was a pastor, a reverend of the Lutheran Church, and from there he became a professor of theology. And so we watched all of this, also watched him getting promotions and sitting in very big offices and big rooms. So I think that was one of the things that really inspired me. I guess also, growing up as a child of a pastor, and later he became a bishop. I think the values and the Christian values that we grew up with obviously shaped me as a human being. But later on, I think I was, I went into medicine at a time where there really were few Black women that were medical doctors, and if they were there, we really didn't know them. I mean, I'm looking back at 94, and Nkosazana Dlamini Zuma was probably the first Black female doctor that many of us got to know about. But in reality, we had not met these people. These were people you could see on TV. But like, if you had asked me when I did my first year of medicine, have I ever physically met a Black female doctor? And I hadn't, Sure. Yes, now I was in a medical school and I was seeing that, they are there and they are training and they're, well, there were not many, but they were there. Mm-hmm. But I also had to ask myself, kind of, reconcile the image that I had in my mind of an Indian or white male as a medical doctor, and then what it means now for me as a Black female to be in that role, and what kind of doctors do we want to represent and become as Black women. So those are just some of the things, obviously, that along my journey helped me to think about the future and what I wanted to become. But, it was later becoming a doctor, then specializing, as I explained. Then I got, and I studied at UKZN, and then I specialized here at WITS. Then I got an opportunity to do my PhD, which I also did here at WITS. Shortly after that, I got an opportunity. I was awarded by the Discovery Foundation a fellowship to go do my postdoctoral studies at Harvard and Massachusetts General Hospital. And at that point, that's where I chose to do my postdoctoral studies in the field of global health, a bit in obstetrics and gynecology. But that was the time I was starting to see the difference between pure clinical training and learning about disparities in healthcare and learning about health system strengthening. So 2018, I was in Boston, took my family along, my children were there. My sons were 2 and 6 years old. So it became a family experiment, if you want to say. And then I got headhunted by UCT as I was finishing off, and this new discipline called global surgery, which was still quite in its infancy. And I was headhunted to basically come and head up global surgery and start global surgery for UCT. So I became the inaugural head of global surgery at UCT and spent the last 7 years there. We developed a global surgery division, and I did a whole lot of exciting and interesting things. We developed a master's in public health, a specialization in global surgery, supervised PhDs, master's degrees. We also developed an executive leadership course through the business school in global surgery. And then earlier this year, I applied to become the head of School of Clinical Medicine with WITS, and recently just started in this position.
And here you are now. So what are your priorities as the head of School of Clinical Medicine?
So my job is quite big. It's quite a huge responsibility. So essentially, I'm the head of the medical school. If I'm to simplify it, the medical school or the School of Clinical Medicine has got 9 academic departments, and these are, so the School of Clinical Medicine trains doctors and specialists. Those are our primary functions. So the MBBCH degree, which is the Bachelor of Medicine and Surgery, comes through the School of Clinical Medicine. We also have the Bachelor in Medical Practice, where we train clinical associates as well. But almost all the specialties that you can think of, from becoming an obstetrician and gynecologist to a pediatrician to a surgeon, all sit within the School of Clinical Medicine. So in total, we've got over 3,000 students, and in terms of our staff, we've got close to 2,000 staff members. So it's the biggest School of Clinical Medicine in the country, possibly on the continent as well. As you know, this is Johannesburg. And yeah, basically our clinical platform really provides healthcare for almost the whole of Johannesburg and the surrounding areas. And so, yeah.
Sure. So when we look at the kind of leadership style that you have, how would you describe that?
So the word, I've got 2 words, right? And more recently, I actually used the word, the phrase energizing leadership, and I use that because, especially in my previous job, where you're starting something completely new, and you need people to buy in and become part of this and drive this movement basically the whole world needs to join. You need to have the kind of leadership that is going to encourage people to wake up at night, in the morning and do this, And it's one thing to sell people something that they know and they are familiar with, but when you're selling something that people don't know and something that looks risky and to some that looks suspicious, I think you need a certain kind of personality to do that. And so this phrase, energizing leadership, I think I felt described me and part of how I lead. But I also believe in transformative leadership, that, when you lead and when people engage with you and when people engage in the things that you do and you create, it needs to be impactful. It needs to change them. When people walk into your room, they need to walk out feeling like this was positive, this was good, this was inspiring, versus being a leader who's just telling people what to do. So I lead more from a place of trying to inspire people, trying to show them impact, trying to show them how good they are and what they can achieve, even if they've never done it before.
And so for you, effective leadership, what does that mean for you? And how do you continue, like you say, the energizing leadership, how do you mirror the two?
Yeah. So I'm very performance driven and very extremely. I'm a doer, and I've had to learn that just because you're a doer, it doesn't mean you have to do everything. And now, how do you get people to do things that they were not planning to do? Because all of us wake up in the morning and we've got our own plans for what we want to do. We all have our strategic priorities and all of that. And I've had the luck or the privilege of also working with governments or entities that support government, WHO, etc., departments of health, ministries of health, and you are going to sell them something, that is not on their strategic priority. But I've got my own KPAs, which I need to achieve as well. And so I think you really have to combine inspiration and motivation to drive performance, because then you don't have to actually do everything yourself. People then volunteer, I'll do this, I'll fund this, and then it becomes we all work towards achieving a common goal. So a lot of what I do is talking because you need to motivate, encourage, have meetings, have coffees with people to get them all on the same page and to get us all aligned in what we need to do. And then it's easier then to be effective and achieve your own performance targets.
What do you think are some of the biggest challenges that are facing medicine, education medicine in South Africa today?
So there are a lot. There are a lot. And I think, I can talk about the challenges in healthcare. For example, we all know the shortages of healthcare workers. We've got doctors who are unemployed right now. We've got specialists, who are also, their employment is not guaranteed either. They go through the training. They have to compete for jobs at the end of the day. It's not like before, where the country really recognized and prioritized and saw what we do as a scarce skill. But also many work also in systems that don't provide all that they need to, And as I was saying the other day, you can go through the best level of training and as a specialist, but you're in a place that doesn't provide the resources that you need to save the lives that you were trained to save. And so the decisions that you have to make on a daily basis, whose life am I going to save? And that's not what you sign up for when you study medicine. But I guess if we go purely to an academic perspective, is you are wanting to train both doctors and specialists in a system that is overcrowded, overloaded, they need to provide the service, and often at the expense of the academic activities that we are trying to push. Often the research that as a country we could lead in so many areas of medical research, but there just isn't enough time for those in the academic sector to actually focus on the research and prioritize the research. So we are working in a system that often forces the doctors who are in training and those who are training to specialize, even those who are teaching, who are employed as academics, where they often have to choose between education and clinical service. And because we are primarily trained to save lives, we are always going to prioritize saving lives and providing clinical services, but at the risk of not advancing and progressing and with clinical education and clinical research, meaning that across the world, if you look at leading medical schools, we will fall short because we are not prioritizing what our core business, and those are the risks. We understand we could be coming up with advances in medicine and new ways of doing things and new technologies, but there isn't time that allows us to do that because of the way the system currently functions.
What do you then make of the current healthcare system?
Yeah.
And I suppose we can say the public healthcare system, because I suppose that's where we often see the faults. But even with the private healthcare system, what do you make of where we are sitting as a country now?
It's a very tricky question, right? Because there are a lot of centers of excellence, right, and pockets of excellence, and a lot of amazing people doing amazing things, and we often forget to recognize that and to see those great things that are happening in the system and in the public sector, because almost all of our tertiary education within medicine happens within the public sector. It's luckily, it's one of the institutions that actually has a private hospital, and some of the training actually happens within a private hospital. But most of the training across the country actually happens within the public sector, and we don't recognize and celebrate that enough. But having said that, there are so many challenges within the health system, and I try not to be one who's very negative and who's and particularly, I guess, for this conversation, my contribution to the health sector is more on the academic side, and I'm very mindful of that and how the academic side also strengthens the public sector and contributes to the public sector. But I'm not one to sit and complain about how bad things are, because I think the unique position that I'm in also allows me to contribute positively towards improving and strengthening the system.
And of course, you can't do that alone. Improving and strengthening that system. It is a combination of sectors that need to work together, government being one of them. Communities as well need to work hand in hand to improve that particular system. How do you think that can be done? What can the government do? What can communities do to make sure that their healthcare system is improved, that it's is in a much better condition?
So all of this works around partnerships, and it's public-private academic partnerships, it's community-based organizations, and we all have to work together. We all have different roles within the health system, and I think everyone needs to do their part, and strengthen their part. But there's no way we can run a successful academic training programs without collaboration and partnership with government, And as you'll know, every province has got, MOUs with the provincial departments. When we also work with other provinces, we also sign MOUs with them, because it's one thing to teach within the university, but we teach on clinical platforms where patients where patients are being treated. And so I think it's a partnership at the end of the day, and it's the fact that together we can all, create a stronger health system with good collaboration and good cooperation.
Let's talk a little bit about the research, right? You've done a lot of research as well around maternal health to ensure that women, like you say, don't die still, even though they've given birth or even during their pregnancy journey. That particular research, Prof, how can it be translated to policy so that it's actually taken more seriously, so to speak, and that it actually can save lives?
Yes. So, and I've had the privilege of also contributing towards policy in my own discipline. So, but generally, when one starts to do their research, you think you're gonna get a Nobel Prize. You think you're gonna change the world, and you'll be on the cover of the Lancet journal and all of it. But in reality, that's not what happens. If you're lucky, you get a publication out of your research, and even if it's just in a local journal, it's fine. We all start somewhere, and but it's building on that research. If I had stopped my research, with my PhD, I mean, since then, the number of papers that are published and the amount of work that we've done. When I started the PhD, I thought this is it. This is the work. This is the groundbreaking work. But more than a decade later, it's actually what happened, what other research I did, over that 10 years or so, building on what I had started. So I think from a research perspective, it's important that one recognizes that it's a lifetime of work, and at first it might be getting it into a paper, but you take that paper and you start associating and networking with influential people that are decision makers as well. And sometimes it might be the opportunity to present your research at a committee, and it might just be a committee, I don't know, at provincial level or something, a committee that is not necessarily changing guidelines and for the whole country or for the world. Many of us start with just a small platform for us to share our research. And for me, that's the most important part, that we learn to take our research, present it in rooms where decisions are being made, and you find with time your influence grows, right? Now, as I was saying, this year alone, I presented research in one. It was in ministerial. Not it was. So the one was the Eastern, Central, Southern Africa hub, and it was a Ministers of Health meeting. It was in Swaziland, and I presented some of our work on stillbirths and the research that we did there. And that was where they were then developing their resolutions and basically what will influence policy for those the African countries that were represented in that meeting. But then I also presented at the SADC Ministers of Health meeting a resolution on access to surgery. Now, you go there, you've got 5 minutes to present a resolution that the Ministers of Health are then going to decide whether to adopt or not. And then if they adopt it, then it goes into policy. And because it's regional, then it's multiple countries actually adopting this as something that they will then put or move towards institutionalizing at country level in various countries. And when you get it for SADC, other regions as well are watching and listening and may also want to push that resolution in their regions as well. I also spoke about, as the director of the WHO Collaborating Center on Integrated Care, and that gave me a lot of opportunities to present work in Geneva, and in various committees, etc. With UNICEF, I sit on the United Nations Coastal Birds Estimates Group. So the journey of doing a small, research project to getting a paper and multiplying that, but ultimately moving it to a place where decision makers are actually listening to your research and are willing to put your research into policies, etc., is something that is achievable, and it's also something that I think we need to push as academic institutions and teach and train on that.
How do you balance it all, ma'am? You're a mom, you're a wife, you are a leader, you are a researcher, you are a teacher. How are you balancing it all, do you think?
I don't do it all at the same time. I think that's one thing. I mean, I've got a few principles that I use, sort of just my own frameworks for life. On one hand, one must always say that I don't have it all together, and it's not as balanced as it looks. And one often has to make sacrifices and make choices of, what am I going to sacrifice, because I can't be everywhere at the same time. But sacrificing, for example, a soccer match doesn't equate to sacrificing your children, and it's not neglecting your duties as a mom. And so one needs to understand those things, understanding their roles. I always think first, who am I? What am I here for? If I woke up tomorrow and, my family and everyone else wasn't there, what would my purpose be? And would my purpose, as I currently know it, still remain? And so I think for me, that's always an important principle that I keep in mind, because it reminds me of why I wake up and come to work every day and why I enjoy my job, whilst, I could be doing many other things. So that the strong sense of I'm doing something that I'm deeply passionate about as my day job, and even if I was the only person left on this planet, I would still want to wake up and do this. At least keeps me grounded in what I'm meant to do and what I should continue doing. It helps to have a family that's supportive, that is not making me choose, But of course, you make choices every day, But even though I say that, before I'm all of these things, I'm a mom and a wife, and I think my family knows that and appreciates that everyone sees me high heels, all of that and whatnot, and for my family, they just see their mom with jeans, t-shirts, all of that, I think they've got a completely different picture of who I am or who I think I am. Sometimes I'll be leaving the house all dressed up and they're thinking, oh, what's going on?
Who's that?
Who's that? And I think it's, I guess it's that balance between when I'm at home, when I'm with my family, that's who I am, and being true to being the mom, the sister, the friend, the daughter, and just being that person. I'm not the head of school at home, and sometimes I wish I was. Sometimes they don't, I feel like they don't take me seriously enough, But yeah, I think it's being true to that. And also, I think things have improved a lot in the workspaces, or in some workspaces. Even for me, I remember early on in my career, people would ask for a meeting at 5 in the evening and whatnot. And, and it was that sense that these are men who are not going home to cook and prepare meals, and so they are choosing these times that are convenient for them, but they're not convenient for us as young women in leadership. But now I think we've got a better handle. I'm not saying it's perfect, but I'm just saying I've seen a difference in feeling accommodated in terms of, how we schedule, life and work and whatnot, that I can actually leave work and say, I'm done. I'm a mom now for the next few hours. Of course, we'll take work home. It goes without saying, but one feels like they can balance their roles a bit more in a world that is also led by women.
Absolutely. Let's speak about the hope the hope for the future of medicine in South Africa.
Yeah.
What excites you about that?
Yeah, I think there's a lot. First of all, that South Africa contributes to the world. I think, firstly, to it's not, our excellence in academic medicine in South Africa is not just for South Africa. It's for the continent. It's for the world. And some of the things that, for example, people come to South Africa to get healthcare, and it's interesting when we talk about medical tourism, and we often don't talk about it in good light, but the reality is that in a world where people can choose where they want to access healthcare, and whether you are poor or rich, I want to say that because often when we talk about people crossing borders and traveling to look for good healthcare, we are imagining very rich people who can pay their way into any country. But we also know our reality is that people travel from neighboring countries, etc. But you wouldn't travel if you doubted the kind of care that you would get. And I think, and I say this at a very controversial time to say it in what we are going through right now in South Africa. But I think as a country, we've got a lot to be proud of. As academic centers, South Africa has contributed to the training of specialists for many African countries, for a lot, and before a lot of African countries had colleges of medicine where they could train specialists. A lot of them were actually being trained in South Africa by the colleges of medicine in South Africa. So there's a huge history and contribution to healthcare. But I think the future needs to look at innovation and advances in medicine, and how we can increase our impact in medicine, and how we can contribute better globally to advancement of medicine. And so those are the things that I'm excited about. Those are the things I think about, if we're looking at new courses or new degrees and whatnot. Can we, and particularly here, I'll speak about Wits, because this is where I'm sitting, and it's, can we look at how we can contribute to the future of medicine as a leader in medicine, and not always being on the back foot where we're just trying to catch up with our workloads and the clinics and the long queues, but rather what new innovations and inventions can we bring to the world? And that is what gets me excited.
Sure. Let's then speak, when we speak in future, AI. It's something that will, of course, I'm sure, affect your work as well. How are you welcoming it into your space?
Yeah, and I'll be honest, many conversations we are having about AI as Africans, about us as recipients of AI, that, there are people there overseas who've created AI, and how are we going to receive it? Do we like it? Are we rejecting it? Why are we not developing, our own, advances in AI? Why are we not having the conversation as how can we design new apps or whatever using and creating AI? I need to learn the language as well. But my point is, AI is here, and why are we not making the most out of it and using the opportunity, and not simply looking at ourselves as recipients? So my agenda, at least with AI in the medical space, is shouldn't we be looking at advancing medicine through AI, digital health, data science, and all of these things, and creating these disciplines or programs, as Africans as well. It shouldn't be that, when a medical doctor wants to do digital health, they need to go and study in another continent and then come back and still not know where they're going to work and who's going to accept them and all of that. And then they stay there. They don't come back because we are still debating, whether we accept AI or not. It's with us. We need to embrace it. We actually need to use it, and there's a lot of evidence that show that in unequal societies, AI can improve access to healthcare. And we need to start designing and developing things that will improve that.
What are some of the lessons, do you think, Prof, that South Africa has learned from the COVID-19 pandemic that we just should never forget when it comes to our healthcare systems?
So, I think we learned, there were a lot of lessons. I think embracing critical care as an important discipline that came out of the COVID-19 pandemic, because previously we knew, the sickest people will end up in ICU and whatnot. But I don't think we've ever rapidly needed so many ICU beds, for example, that and knowing that the speciality itself is going to provide those solutions that were required. A trauma was important. I'll say this again. I'm allowed to say things that may sound controversial from time to time. But we realize that, when you switch off the alcohol taps, there are less people in the hospitals. There's less violence. There's less. Our trauma units were empty. Just by switching the alcohol taps. And I don't think we've embraced what that means for a healthier South Africa, for a safer South Africa, for a South Africa which has fewer patients in our hospitals, for a South Africa which has high rates of gender-based violence, which again come from some of the alcohol abuse and what happens related to that. I think those are two important lessons. Of course, and I think for me, maybe just the third one, there was a very coordinated, I don't know what to call it, but I think we were all organized and prioritized healthcare from the president running the family meetings, to the Minister of Health and all of. There was a very clear and coordinated agenda in healthcare, both politically, both administratively, within the medical disciplines, health disciplines, etc., which we also lost that, because if you look now, when you say what are the biggest challenges in healthcare, if you speak to 10 of us, you are going to get 10 different priorities, because it's not around the burden of disease. When you speak to me, I'll speak about my interest in healthcare, and we've gone back to what individuals and what groups are interested in versus what the country needs.
Let's then look at the profession in itself, but also when it comes to women leadership. Where do we stand in South Africa, do you think, where we've got women like yourself that are in a leadership position? Is it still seen as an industry where we're seeing more males than what we are females, and specifically Black females?
Yeah. So I honestly think we still have a long way to go, and I'm sure I don't want to speak about the stats and the numbers, but I think what I am happy about is it's no longer, well, we are getting fewer and fewer announcements that, oh, this is the first Black female, this and that, and it's no longer scary that a Black woman has been appointed to a senior position, and it's not always met with mistrust and question of capabilities and qualifications, and can she really do it? And I think for that, as a country, I think it's a good sign that, when there is an announcement about a Black woman getting into a senior or an executive position, we all sit back and we actually happy, and often we can see that the person was appointed on merit and that they are capable of it. But I'm sure the numbers don't say what me and you want to see, because if you really interrogate what is the number of women in executive positions versus men, I think there are still very huge disparities. And so, yeah.
Certainly. What excites you or concerns you most about the next generation of doctors that you are training here?
So I'm hoping that one, that this will become more of an exciting place to come and do medicine, and that people will walk away from here with very positive experiences and being able to contribute to healthcare and to make a difference, as we said at the beginning. But I think it's my excitement is more around, if we get this vision right, then the next generation is going to be so equipped to actually advance medicine and bringing new innovations, etc. And so I'm excited about it on the condition that we get it right. Okay. If you understand what I'm saying, it's not I guess I'm also trying to say the responsibility for what the next generation looks like, it falls on us. And I'm not taking that lightly, but if all these amazing ideas become a reality, then we'll have a different or a better generation, and that could really have a global influence and global impact in terms of what they achieve.
What would it take for your vision to be realized and for it to get to that point where this generation is excited about medicine?
Yeah. Sure. So I'm an optimist, eternal optimist, and I in my mind, they are excited about medicine because if you think about the number of people that apply to get into medical schools and the number of people that qualify but don't have enough spaces to get in it, it surely says to you that we have a generation of people that want to become doctors, that want to become specialists, it's still a noble profession, and there's future generations and pipelines of people that are waiting to get into the system. But what will it take? And I think it goes back to, I guess, the transformative leadership, and being able to manage change and to achieve change, constructive change, good change, but and being able to implement, and not just being a visionary, but actually putting systems in place, getting the correct operations in place, you know, for firstly, all of us to see the potential that we have or what we could do within medicine, but being able to operationalize some of these ideas and dreams. But of course, once it's in positions like this, for a 5-year contract and all of that. But my passion for it is definitely not a 5-year, vision or whatnot. It's a lifelong mission, and I guess the story of how medicine, or how the future of medicine unfolds, will keep unfolding, regardless of where one is sitting.
Mm-hmm. Can I put you on the spot just a little bit?
Yes.
So, of course, you were recently appointed at the beginning of this year. You've got 5 years in this term.
Yeah.
What are you hoping to change? What did you find? And you're just like, this is something that you have to turn around completely.
It's a difficult question, because I'm also, I guess, I'm an innovator by nature. So I could find nothing, and I can see how we're gonna build something out of it. And I find something completely there, a system, the house is there and whatnot. And it's like, okay, how do we improve this? How do we, and so I'm not necessarily sitting here and feeling like we need to change everything and start afresh and whatnot, and let's destroy this and this. I'm not there at all. I'm actually quite excited about what I've found, and really feel like it's how do we innovate, and how do we improve, and who should we be benchmarking against, and historically, who did we benchmark against? But where we are now, how do we really grow, our brand as a world-class, medical school, for example? What kind of academic innovations do we need? How do you want to improve our impact? So I'm really one who is, I abide by what we call improvement science, and I think that's me. So no, we're not tearing down the house. Okay. Not at all. It's actually, I actually feel like there are so many brilliant things and so many untold stories right here that need to be shared with the world about the areas of excellence and the achievements that are here that many people just don't know about.
What would you say has been the most rewarding moment of your career so far?
Sure. I don't know, they've been so many. They honestly have, and they've been unexpected, unplanned. You think, by this age, you'd think someone has a 10-year plan, no? But not quite. I think becoming a full professor, I was 39, I think, was a huge achievement. And I don't know what the stats are or whatnot, but people kept saying, oh, she's the youngest, she's probably the youngest and whatnot. And obviously, as a Black female, becoming a full professor of medicine was a huge deal at that age. It wasn't that long ago. I mean, it was about 4 years ago.
Sure.
But I would say that it used to be, getting the PhD, but the PhD then led to the postdoc, to the professorship and all of that. And currently, I think sitting in this important position as a head of school is certainly not something I would have imagined a decade ago when I was, I'm 43, if I'm to put it out there. If you look historically, these are not the things that one imagines for themselves in their early 40s, because these are not things that we've seen. These are, people sitting in these positions were much older, and so I guess it's these are my highlights and the things that I'm really grateful for. But I take them again with a deep sense of responsibility, and I don't take them purely as personal achievements.
Do you think that there's then a heavy, I don't want to say heaviness, but that there's a bit more pressure on you because you are young? All eyes would be on you to say, she's a professor, she's a head of School of Clinical Medicine at Wits. What is she going to do? Do you think that pressure is there? Do you feel it?
I assume it's there. I would imagine that people are looking. The nice thing is people don't necessarily say what they are thinking out loud, and it's been a lot of congratulatory support, all of that, which has really left me to kind of sit in my own bubble, and I think the balance for me has and I'm very inward driven, if I can put it that way, and it's always been about what would I want to achieve from this, and the pressure, I guess, that the world may exert on, will she get this right? I think that's not the pressure that keeps me up at night. The pressure I put on myself to succeed is the pressure that I'm more afraid of. Because it's the, can I face myself in the mirror type of pressure. And so I'm very inward driven, even though very collaborative. I'm a co-creator, but I think I put a lot more pressure on myself than other people put on me.
And so when you face setbacks, what keeps you going? What motivates you to keep on moving?
It's a sense of purpose. My faith, is important, because some days, when all is said and done, it's not the motivational speeches and books. Sometimes you just need to quote your scriptures, and that's the only thing that's gonna keep you going. But having a strong support system helps a lot, because those are human beings that can say to you, who can wipe your tears when you're crying, who can, those, my husband, my parents, my even my children, and my sisters. Those are people that really, when I'm having my difficult day and the rest of the world doesn't see it, and some days I'm having a horrible day, and everyone is just like, "Oh, but you've made it." But the people that are closest to me, I think, serve as my, let's keep going, let's keep going, even when it feels like it's not worth it.
What's the one habit which you think that contributes most to your success, or has contributed most to your success?
I think one of the biggest lessons I learned, and this was from my father, actually, just finish what you start, like, even if you'll never use it again. And he played a trick on me because the part I didn't talk about was wanting to quit medicine
Oh.
in second year and feeling like I signed up for the wrong thing. This isn't me, like, And later I tried quitting again. Story for another day. But when I wanted to quit medicine, he simply said to me, you need to finish what you've started. And I was like, there's no point in finishing because I don't want this career. I don't want to be a doctor. But finishing, and then later in life, you realize, actually, I love this job. I'm passionate about it. So I use that principle in big things and small things. And sometimes it's finish the paper that you are writing, or close the loop. You've spoken to people, you've proposed you want to do this, go back and close the loop. And so I think for me, that's just, I can't. My habit is I've got a to-do list like most people, and ticking the thing that I've done and finished is I think that if in terms of a habit, that is one thing. And so it constantly pushes me to keep going to finish those things for whatever worth. But I certainly have found that by finishing things, even things that don't seem important, later those things come back and open up other doors, and they become relationships that you use, etc.
Absolutely. So, for you, Prof, coffee or tea?
I quit coffee.
Oh.
I was an addict. Recovered. I quit coffee about a year ago.
Okay.
So
Any
tea.
reason for that?
Ooh, it's personal.
Okay,
Yeah.
no problem. Do you do books, movies, or series?
Books.
Books, you prefer
Yes,
books.
books.
What's your favorite place to unwind?
Give me a couch, a big couch any day. Like I'm not even send me on a holiday. I'll just put me in a room with a comfortable couch and a blanket and a heater, and I'm good.
And you're
That's
sorted.
how I unwind, and then I can do other things and fun things. Yeah.
One person, living or deceased, that you would love to have dinner with, and why?
Sure. Ooh. Sure, I have to think about that one. I have to. I mean, interesting. I mean, I guess, maybe it's appropriate. Someone that I always used to follow was Michelle Obama, for example, and I had the opportunity of attending her book launch, except there were 80,000 other people. But I like using the line. I was like, I went to Michelle Obama's book launch. You can imagine. It's up to you to decide whether there were. I'm not gonna say it out loud, But yeah, also, I mean, I guess Michelle and Barack are probably people that I'd be interested in having a conversation with. And I guess it's just, seeing, I think they've contributed to history, and those are people that inspired me, and I continue to inspire, watching also what they've been doing recently.
What's the one thing that you think people would be surprised to learn about you?
I don't know. People get I get shocked to see that I'm a fun person with my own weird sense of humor. I find people take me seriously, more seriously than they should. But I'm actually a very simple, relaxed, fun, loving person. So. Unless if you don't know me that well, I find people get shocked when they see me relaxed and all, and being myself.
You've gotten that side of you, which is so lovely. Thank you so much for your time, Prof. Truly appreciate it. What a lovely conversation. Hope you've also been inspired as much as I have been by Professor Salome Maswime, who is, of course, the head of School of Clinical Medicine at Wits University. That's how we'll end off this episode of Conversations with Eminent Women. From myself, Tsegohaja Moagi, and the full team, thank you so much for watching. Remember to like, share, and subscribe. And wherever you go, whoever you encounter, just be kind and protect your peace. Bye-bye.